Assalamualaikum and a very good day to our judges and my beloved friends. My name is Amaluddin Fitri and I'll present to you my FYP entitled Identification of Virulence Genes in Clinical Isolates of Staphylococcus epidermidis. The first part of my presentation is the introduction, in which we have three components: the background of study, problem statement, and objectives. My background of study is Staphylococcus epidermidis. So what is Staphylococcus epidermidis? It's a normal skin flora that found on human skin. It is a gram-positive bacteria and a coagulase-negative staphylococcus, or known as cons, and it has virulence factors, which is biofilm formation gene and MAC-A gene. The problem facing with S. epidermidis is the infection acquired during the process of receiving health care that was not present during the time of admission, or also known as nosocomial infection. The other problem is that it is a concerning infection in medical fields such as endocarditis infection, sinus infection, inflammation, and etc. The significance of this study is to collect the data of virulence genes of S. epidermidis, in which it will help for a better therapy management and to fight against the infection of S. epidermidis itself. There are two objectives that I want to highlight for my findings. That is, number one is to determine the biofilm gene IKED in S. epidermidis clinical isolates. The second one is to determine the MAC-A gene in the S. epidermidis isolates. The second part of my study is the literature review. So, S. epidermidis usually profound on human skin and mucous membrane. The characteristic of Staphylococcus epidermidis is presented as gram-positive bacteria, cons, which is coagulase-negative staphylococcus, and is known as skin commensals in which it is not harm or infectious. So, it also has virulence factors such as biofilm formation, antibiotic resistant, and mobile genetic elements. The most common infection by S. epidermidis is nosocomial infection on indwelling medical devices, and is resistant to most antibiotics, such as beta-lactam antibiotics group. Here are some of the virulence factors that are presented by S. epidermidis. The first is IKED gene. Is the production to biofilm formation and have an ability to adhere on surfaces such as a medical device, that soon it will cause disease and infection to immunocompromised patient. There are few steps in biofilm formation. Number one is the attachment to the surface on biomaterials. Next is the accumulation phase, in which it grows and forms multicellular aggregates with the help of the polysaccharide intercellular adhesion (PIA) that can increase intercellular adhesion. The third step it undergo maturation to form structure, and the final step is dispersion of individual cells to another surface. Next is MAC-A gene, in which is the mobile genetic carrier resistant gene, and is typically resistant to various antibiotics such as beta-lactam. My third part of this presentation is the methodology used in the study. This is my flowchart of my research on S. epidermidis. This is my flow on how I answer my objective 1 by amplifying IKED gene with single multiplex PCR methods. Same goes to my objective 2, is to amplify MAC-A gene using single-plex PCR method with designated primers and step into the PCR. The result of my study is shown in the slides. I have done gram staining to identify the morphology of S. epidermidis, also streaking on MSA agar, and done a coagulase test to differentiate Staphylococcus aureus and S. epidermidis due to S. epidermidis lack of coagulase enzyme. This is my gel electrophoresis result on IKED gene amplification using the same species but different strains, which is ATCC 35984 as my positive control. This is my gel electrophoresis result on MAC-A gene amplification, also using different strain, which is BAA 2064 as my positive control. For discussion of my study is that the IKED has failed to show the targeted gene and repeated with another set of primers and turns out the same result. The biofilm formation ability were absent for IKED gene in my isolates. The other study shows that ICA-AD is the main component to form the biofilm. For MAC-A, 3 of 6 isolates were strongly visible in the gel. This shows that the isolates have ability to resist any possible antibiotics. Study shows that it may have possible to have several gene transfer that have resistance to antibiotics. In my conclusion, ICA-AD gene were not present in the isolates due to lack of biofilm formation gene, and for MAC-A gene that is successfully obtained in the isolates. Both of the objectives were achieved. For future recommendation, using multiplex PCR method to amplify several DNA and use single primers such as ICA-A and ICA-D separately. Other is amplify other biofilm associated genes.